Did you know that consistently high blood sugar can silently damage your heart, kidneys, and even your vision without you feeling a thing? But here is the good news: with just a few simple tweaks to your daily routine, you can take back control and protect your health. In this video, I will show you how to master your blood sugar levels with easy to follow tips, practical tools like a glucometer, and a balanced approach to diet and exercise. Whether you are struggling to stay on track or just starting your journey, this is the guide you have been waiting for. Let us dive in and take the first step towards a healthier you. First, let us talk about why managing blood sugar levels is so important for people with type 2 diabetes. When you think about diabetes, it is easy to focus only on the blood sugar levels themselves. But what does high blood sugar actually do to your body? Type 2 diabetes occurs when your body either doesn't produce enough insulin or becomes resistant to it. Insulin is like the key that allows sugar to enter your cells and be used for energy. Without it, sugar builds up in your bloodstream like a traffic jam on a busy highway. Over time, consistently high blood sugar levels can wreak havoc on your body. It damages blood vessels and nerves, leading to complications such as heart disease, kidney damage, nerve pain, and vision problems. Think of it as wear and tear on your body's delicate systems. By consistently monitoring and managing your blood sugar levels, you can prevent these complications, improve your overall well being, and live a healthier life. Managing your blood sugar is about finding a balance between your diet, exercise, medications, and daily habits. It is a partnership between you and your healthcare team, with you at the center of decision making. Now, let us explore how you can monitor your blood sugar effectively. One of the most powerful tools for managing type 2 diabetes is daily blood sugar monitoring. Think of it as checking the weather forecast before planning your day, just as you wouldn't leave the house without an umbrella on a rainy day. Monitoring your blood sugar helps you prepare and make adjustments to your diet, activities, and medications. It is not just about knowing the numbers, it is about understanding how your body responds to different factors like food, exercise, stress, and medications. This insight gives you the power to take control of your health and prevent potential complications. Daily monitoring doesn't have to be complicated. By incorporating it into your routine, it becomes a natural part of your day. The first step is to establish a monitoring schedule. Regular testing provides a clear picture of your blood sugar trends and helps you make informed decisions. For many people, this means testing multiple times a day: before meals, 2 hours after meals, and at bedtime. Each person's schedule may vary based on their health needs, so it is essential to work with your healthcare provider to develop a personalized plan that fits your lifestyle and treatment goals. Keeping a log of your blood sugar readings is an invaluable habit. Think of it as more than just writing down numbers. It is like creating a diary of your health journey. Many people find smartphone apps to be a convenient way to track their readings, while others prefer the simplicity of a traditional notebook. Whichever method you choose, make sure to include additional details such as what you ate, how much physical activity you did, your stress levels, and any medications you took. This comprehensive approach transforms raw data into the meaningful insights, helping you identify patterns and understand what is working and what needs adjustment. Knowing your target blood sugar range is equally important. For most people with type 2 diabetes, the general guidelines are to maintain blood sugar levels between 80 to 130 mg per dl before meals and less than 180 mg per dl 2 hours after meals. However, these targets aren't one size fits all. Factors like your age, overall health, and how long you have had diabetes can influence what is best for you. Always consult your healthcare provider to determine the most appropriate range for your unique situation. By consistently monitoring your blood sugar levels, you gain a deeper understanding of your body and how it reacts to various factors throughout the day. This empowers you to make timely adjustments such as tweaking your meals, planning exercise, or discussing medication changes with your healthcare provider. Monitoring is more than just a routine, it is a proactive step towards living a healthier, more balanced life with diabetes. Now that you know that how to monitor your blood sugar, let us focus on interpreting the numbers you see and making necessary adjustments. Managing blood sugar level is like fine tuning a musical instrument. It requires balance, attention, and responsiveness to the subtle shifts in your body. Understanding what your results mean is empowering. It is not just about knowing the numbers, but about using them as a guide to optimize your health. Let us explore how you can act in these insights. Low blood sugar or hypoglycemia occurs when your blood sugar levels fall below 70 mg per dl. It is your body's emergency signal that it needs immediate attention. This condition can rise from skipping a meal, taking too much insulin or medications, or engaging in intense physical activity without enough fuel. Common symptoms include shakiness, dizziness, sweating, hunger, and irritability. If left untreated, hypoglycemia can escalate into confusion, fainting, or even a medical emergency. In order to address it, consume a fast-acting sources of sugar such as 15 grams of glucose tablet, half a cup of fruit juice, or a tablespoon of honey. After consuming, wait 15 minutes and recheck your blood sugar. If it is still low, repeat the process. Once stabilized, follow up with a small balanced snack to prevent another drop such as slice of whole grain, bread with peanut butter, or a handful of nuts and fruits. On the other hand, high blood sugar or hyperglycemia occurs when your blood sugar levels are consistently above your target range. This can feel like a slow burn, often presenting with the symptoms such as increased thirst, frequent urination, fatigue, and blurred vision. Hyperglycemia might not seem urgent initially, but over time it can lead to serious complications like nerve damage or kidney stones. Causes of hyperglycemia can include overeating, especially high carb meals, missing medications doses, stress, illness, or lack of physical activity. To manage high blood sugar, review your diet and focus on fiber rich and protein packed options while reducing refined carbs and sugary foods. Light physical activity such as 10-minute walk can help lower blood sugar naturally by encouraging your muscles to use glucose. Drinking plenty of water is another effective strategy to flush excess sugar out of your system. If your levels remain high despite these efforts, consult your doctor to adjust your medication or insulin doses. Keeping a blood sugar log isn't just about recording numbers, it is about getting insights into how your body responds to different factors. Patterns in your reading can reveal cause and effect relationship and help you make more informed decisions. For instance, if your blood sugar consistently spikes after breakfast, consider replacing sugary cereals with high protein options like eggs or Greek yogurt. If stress tends to raise your levels, integrating relaxation techniques such as meditation or deep breathing can be beneficial. Additionally, tracking how activities like exercise or meals affect your reading allow you to tailor your habits for better control. Monitoring your blood sugar is crucial, but it is just one piece of the puzzle when it comes to managing type 2 diabetes. Two of the most powerful tools are diet and exercise. These lifestyle factors can profoundly influence your blood sugar levels and overall health, making them indispensable component of your diabetes management plan. Let us first discuss eating balanced meals. A balanced diet serves as the cornerstone of blood sugar control. The foods you eat directly impact your glucose levels, and choosing the right combination of nutrients can make a significant difference. A meal that includes a mix of protein, fiber, and healthy fat helps slow down the absorption of glucose into your bloodstream. preventing sudden spikes and crashes. This balance not only supports better blood sugar control but also keeps you feeling fuller for longer. Start by limiting refined carbohydrates such as white bread, sugary snacks, and desserts. These foods are quickly digested, leading to rapid blood sugar spikes. Instead, opt for complex carbohydrates like quinoa, brown rice, and oats, which provide sustained energy and a steadier impact on the glucose levels. Non starchy vegetables like spinach, broccoli, cauliflower, and bell peppers should make up a significant portion of your plate. These vegetables are low in carbohydrates and high in fiber, vitamins, and minerals, making them ideal for diabetic friendly meals. Lean proteins such as chicken, fish, beans, and legumes are essential for muscle maintenance and satiety. They also have minimal impact on the blood sugar levels. Adding healthy fats from sources like avocados, nuts, seeds, and olive oil not only enhances the flavor of your meal but also supports heart health, which is particularly important for individuals with diabetes. Remember to watch portion sizes to maintain a balanced caloric intake. Planning meals ahead of time can help you stick to a healthy eating routine. Meal prepping ensures you have a diabetic friendly option readily available, reducing the temptation to reach for less healthy alternatives when you are hungry or pressed for time. Now, let us talk about regular physical activity. Exercise plays a vital role in managing blood sugar levels by helping your muscles use glucose for energy. Physical activity increases insulin sensitivity, which means your body can use insulin more effectively to lower blood sugar levels. Both aerobic exercises and resistance training are beneficial for individuals with type 2 diabetes, and incorporating a combination of the two can yield the best results. Aerobic activities such as walking, swimming, cycling, or dancing improve cardiovascular health while aiding blood sugar regulation. Aim for at least 150 minutes of moderate intensity aerobic exercise each week, which can be broken down into sessions as short as 10 to 15 minutes throughout the day. For example, taking a brisk walk after meals is a simple and effective way to manage post meal blood sugar spikes. Resistance training, such as weightlifting, body weight exercise, or resistance band workouts, builds muscles and enhances glucose uptake. Including strength training at least twice a week complements aerobic activity by improving muscle mass and boosting metabolism. Activities like yoga and pilates can also improve flexibility and reduce stress, which indirectly helps with blood sugar control. Always monitor your blood sugar levels before and after exercise to ensure they remain within a safe range. If your levels are too low or too high, adjust your plan accordingly. For example, eat a small balanced snack before exercising if your blood sugar is on the lower side, or wait until levels stabilize if they are elevated. Staying consistent with physical activity can also improve your mood, energy levels, and overall quality of life. Pairing exercises with enjoyable activities like walking with a friend or joining a group class can make it easier to stick to your routine. Diet and exercise are incredibly powerful tools, but the key to success lies in consistency and personalization. Everyone's body responds differently, so it is important to find what works best for you. By making small, sustainable changes to your meals and physical activity, you are taking an active role in the managing your diabetes and improving your overall health. Remember, every step counts. Start small, stay consistent, and celebrate your progress along the way. Medications are a cornerstone in the management of type 2 diabetes for many individuals. They play a vital role in helping to regulate blood sugar levels, especially when the lifestyle changes like diet and exercise aren't enough on their own. For some, oral medications like metformin help reduce glucose production in the liver and improve the body's insulin sensitivity. For others, insulin therapy or other injectable medications may be necessary to keep blood sugar levels within a healthy range. Following your prescribed treatment plan is essential for maintaining blood sugar control and preventing complications. It is important to take medications exactly as directed by your healthcare provider. Skipping doses or not adhering to the recommended schedule can lead to fluctuations in your blood sugar levels, which increase the risk of both hypoglycemia and hyperglycemia. Regularly reviewing your medication plan with your healthcare provider is also key, as your needs may change over time due to factors such as aging, weight changes, or shift in your activity levels. Blood sugar readings can provide valuable insights into how well your current treatment plan is working. If your readings indicate that your blood sugar levels are consistently high or too low, it is crucial to discuss these trends with your healthcare provider. Together, you can explore potential adjustments to your medications, such as changing dosages, trying a new medication, or integrating additional therapies. By staying proactive and maintaining open communication, you can ensure your medication plan evolves with your needs and supports your overall health goal. There you have it, practical, actionable tips for managing your blood sugar levels. Remember, managing type 2 diabetes is a journey, and every step you take brings you closer to better health. By combining daily monitoring, balanced nutrition, regular exercise, and collaboration with your healthcare team, you are setting yourself for success. If you found this video helpful, don't forget to like, share, and subscribe to Medifit Mosaic. Let us know in the comments what strategies you use to manage your blood sugar. Thank you for watching, and I will see you in the next video.